Child and adolescent mental health post-COVID-19 in Japan. Konodai Hospital, established in 1872, is the oldest hospital, has a child and adolescent psychiatric ward in Japan, has been treating children with mental disorders since 1948. In 1965, Ichikawa City started an in-hospital school for inpatients for the first time in the country. A current child and adolescent psychiatry ward was established in 1972, and the outpatient unit was established in 1975. In 2019, NCGM had set up the Clinical Center for Children's Mental Health in Konodai Hospital. What is the issue about child and adolescent mental health post-COVID-19 in Japan? Does COVID-19 pandemic affected Japanese children's mental health? With the spread of COVID-19 in 2020, the impact on the lives of children has become significant, as the first ever nationwide school closures have begun in our country. In addition to this massive closure of schools, there have been many news stories and educational activities by various organizations about children who are unable to leave their homes from the perspective of preventing infection and their mental health problems. In 2020, children endure for more susceptible adults. Since the first detection of Delta strains in quarantine in late March 2021 and the confirmation of an infected person in Japan in April, the strain has been rapidly replaced, with approximately 90% of the cases in metropolitan areas where the genome was decoded being Delta strains by the end of August 2021. School closure and some problems in Japan from March 2, 2020, gradually resumes in June. Short the summer vacation, use of masks on the way to school and in school. Starting an unfamiliar online education by public schools, refrain from going out, playing with friends, playing in the park. Increasing the emotional burden on children and parents. Japanese school activities. Online classes were introduced after school closure at 2020, but are now not widely used. Out-of-school programs for social experiences have been cancelled due to the pandemic. School lunches are also eaten together but in silence. Parents are restricted from visiting classes, and parents are not informed of what is going on at school. School closures and children's mental health. Japanese elementary and junior high school students, children became less active, less energetic, and had difficulty finding interests after a prolonged period of school closure. The COVID-19 school closure had negative physical and psychological effects on school children. Screen time was associated with both physical and psychological health. Therefore, school children should not engage in arbitrary screen time during school closures and should be supported in their daily routines. Japan had some problems for child mental health care system before COVID-19 pandemic. Current state of child and adolescent psychiatry care system. Poor health care system for child mental health, such as a few professions, hospital, and institutions. Japanese social issues are to increase in abused children, neurodevelopmental disorders, suicide. Fewer approved drug therapies for children with mental disorders. The increase in child abuse has not stopped. A few professionals to support these children is a serious social issue each local. The child care centers is increasing in each region but not. Increasing hidden child abuse. Domestic violence and child abuse by fathers who have lost their jobs increases after disasters such as earthquake, tsunami, typhoon, and COVID-19. That's why, in Japan, usually the school teacher and pediatricians discovers the abuse. However, school closures and stay home prevent social safety nets from child abuse. These problems may further cause children's mental health issues as COVID-19 pandemic. There are few child psychiatrists in Japan and only a few specialized hospitals in the country. The Ministry of Internal Affairs and Communications also recommends that many children with neurodevelopmental disorders on waiting lists for initial consultations be improved. The ministry also points out the need to maintain local children mental health care. While the consultations regarding children's mental health is rapidly increasing, the current state of child mental health care in Japan is such that there are few child psychiatrists and specialist medical institutions. We believe that the need for child psychiatric care will increase as the environment surrounding children changes drastically with COVID-19 pandemic and the school closure. In Japan system and web system, web medical examinations was a few existent. Currently, web examinations are allowed and some telemedicine is beginning to make progress, but few hospitals have actually adopted it. The first visit is not allowed for telemedicine. Our hospital are also only allowed to prescribe over the phone to those who cannot leave their homes due to infection. A few child and adolescent psychiatrists is treating children with mental disorders in Japan. COVID-19 caused anxiety about the future and increasing parental burden. Pandemic impact on children in general. They is feeling loneliness and anxiety. After 2021, expansion of the child's own risk of infection from days of enduring for the sake of adults. Long-standing problem of lack of places to receive medical care. Impact on outpatient child and adolescent psychiatry. Age of outpatients at Department of Child and Adolescent Psychiatry, Konodai Hospital, NCGM. This graph showed the age and gender of 2,848 outpatients. This graph showed the ICD-10 diagnosis of 2,848 outpatients. F4 neurotic disorders and F5 eating disorders were significant increased after pandemic. Impact of COVID-19 pandemic, hours of sleep. Elementary school students, their sleep durations were no changed. Junior high school students, their sleep durations did not change too. Depressive symptoms. Elementary school students, their depressive symptoms were significant worse after pandemic. Junior high school students, their depressive symptoms were significant worse after pandemic too. Suicide. The suicide ideation and suicide-related events were increased after pandemic. This graph showed action of suicide-related events at first visit. The wrist cut is most popular in Japanese outpatient children. Children's mental health as social issues before and after the COVID-19 pandemic. There was no change in the average hours of sleep among the children. Suicidal ideation and suicide-related events, mainly wrist cutting, also increased. When child and adolescent psychiatric patients' difficulties in daily living were assessed along the course of a day during the temporary school closure period by COVID-19. By the result of our study, burden of parents were worse than pre-pandemic. We found that patients were affected by the temporary school closure period even before the spread of the infection, and that parents may have experienced increased difficulties during the daytime, especially when elementary school students were closed. Staying at home and being less active outdoors can lead to less physical activity, social withdrawal from one's usual environment, less social interaction with peers, more screen time, irregular sleep patterns, and less favorable eating habits. There have also been reports of increased restriction and anxiety about eating behaviors in anorexic individuals with anorexia nervosa under the spread of COVID-19. Eating disorders in the pre- and pandemic. This table showed the age, gender, hospital admission compared children with eating disorders between pre-pandemic and pandemic. Rapid increase in the number of patients with eating disorders. As this graph shows, this is a threefold increase compared to pre-pandemic. Their BMI was not changed. So, children with eating disorder is big increasing, but not worsening in Japan. The most common diagnosis was autism spectrum disorders, followed by neurotic disorders, anxiety, somatic, obsessive-compulsive, etc., and ADHD. The outpatients decreased temporarily following COVID-19 pandemic, but is returning to normal again around March 2021. A significant 3.3-fold increase was observed when comparing before and after February 2020 for eating disorders. With the spread of COVID-19 in 2020, the impact on the lives of children has become significant, as the first ever nationwide school closures have begun in our country. In addition to this massive closure of schools, there have been many news stories and educational activities by various organizations about children who are unable to leave their homes from the perspective of preventing infection and their mental health problems. Rapid increase in eating disorders. Excessive anorexic behavior and low body weight and nutritional status make this an extremely life-threatening condition. Requires inpatient treatment if necessary. Therefore, more difficult to admit cases with issues such as self-harm, suicide attempts, obsessive-compulsive symptoms and domestic violence. One more social issue in Japan. Many problems with parents' anxiety about COVID-19 by media or SNS went to medical clinics that usually not treated children, because they could not reserve specialized facilities. Some medical clinics did treatment not approved in Japan as being performed for a high price. Promotion and solutions to these Japanese issues post-COVID-19 pandemic. Making psychoeducation video for public health in Japan and Philippines by using YouTube. While hospitalization is required for eating disorders in life and death crisis, it may be difficult to treat cases with issues such as severe self-harm, suicide attempts, OCD, and domestic violence. The mass media has been reporting on the collapse of medical care due to the spread of COVID-19, and in the field of child psychiatry, the rapid increase in the number of eating disorders may be pushing the limited medical resources of child psychiatry to its limits. Professions may be called upon to improve our skills in dealing with the rapidly increasing number of eating disorders, especially in outpatient treatment.
最後までご視聴ありがとうございました。ではまた次の動画でお会いしましょう。さようなら。チャンネル登録よろしくお願いいたします。